Good day, ma'am. I'm Valerie Albon. I will conduct an interview. So, before I ask you some question, can I ask a permission if is it okay to get your some personal information po?
Yes po.
Okay, thank you, ma'am. But don't worry because this is a very confidential record of your medical history, and for your doctors, it is important for us to know about your information so we can provide you or give you the best medical or healthcare possible. So the information contained here, ma'am, will not be released to anyone without your prior consent. So I will verify your information here. What is your full name, ma'am?
Micaela Sobrevilla po.
Okay, thank you. What is the date of your birth?
March 26, 2005.
Okay, ma'am. So, your birthdays po?
Inanamal Llanero po.
What about your nationality, ma'am?
Filipino po.
Okay, your religion po?
Born again po.
Do you use drugs or medication?
No po.
Okay, so do you use cigarette or tobacco?
No po.
Okay, that's good, ma'am. What about, do you drink some alcohol?
No po.
Okay. Do you drink coffee or soda?
Yes po.
Okay, so how many servings per day of the coffee?
Once a day lang po.
What about the soda, ma'am?
Once a day po.
Okay, thank you. So, do you have occupation?
Wala po.
Okay, what about your education, ma'am?
Senior high po.
Okay, so your civil status po?
Single po.
Do you have pets?
Yes po.
Okay, so do you exercise? What type of exercise or how often do you exercise?
I don't exercise po.
Okay, so what about your recent or frequent travel destination, ma'am?
Home to school lang po.
Okay, so thank you. Okay, ma'am, so do you have or have you ever had diseases or illnesses such as cancer, respiratory disease, diabetes, or migraines, ma'am?
No po.
Okay, thank you. So what about your past surgical history? Do you experience surgery, ma'am, or having in a surgical procedure po?
No po.
Okay, so that's good. So what about, do you have any allergies, ma'am?
Nothing po.
Okay, so do you have any bad reactions in medications or drugs po?
No po.
Okay, so now what about your family history? So did they experience having disease or illnesses such as cancer, diabetes, heart attack, heart failure, or respiratory disease, ma'am?
No po.
Okay, thank you. Okay, ma'am. So do you currently have fatigue po?
No po.
Okay, what about fever, ma'am?
No po.
Okay, so does your nail changes po?
No po.
Okay, so do you have any chronic cough, ma'am?
No po.
Okay, what about vaginal discharge po?
No po.
Okay, so loss of bowel, ma'am?
No po, but I experience headache po.
Okay, so headache. So, ma'am, when did this headache start po?
2 months ago po.
Okay, 2 months ago. So, can you point to me the area where you feel this pain po?
Here po.
Okay, so at the cited temporal area, ma'am. So, is that the only area or anything else, ma'am?
Dito lang po.
Okay, thank you. So, can you describe the headache po? Is it throbbing, constant, sharp, or dull po?
Sharp po.
Okay, ma'am. So, if you're going to rate the pain that you experience po, 10 is being the highest and 1 is being the lowest. So, what number would you give to me, ma'am?
8 po.
Okay, so 8. How long do you feel this headache po?
2 to 3 minutes po.
Okay, is your headache come and go or do you feel it every day?
Come and go po.
Okay, so thank you, ma'am. What were you doing that moment before the headache strikes you po?
I use cellphone po for the online exam.
Okay, so what are the things that you do to lessen the pain po, or do you take any medications or drug po?
I take a rest for a while po.
Okay, ma'am. So thank you. Aside from the headache, do you feel other discomfort, illnesses, or pain po?
Nothing na po.
Okay, thank you, ma'am. Okay, ma'am. So I'm going to review your personal information. as you stated before, and you do not have or you do not experience po having disease or illnesses po, and then you do not have any past surgical history, and you do not have also allergies and bad reactions to medications and drugs po. And your family history about diseases or illnesses is very clear po. But you currently have headache po, and this headache is started 2 months ago. And the area of this headache po is at the side of your head, which is the temporal area, ma'am. And your description about this headache po is sharp. And you rate this pain from this headache po as 8. And this headache po lasts to 2 to 3 minutes po. And then this headache po come and go. And for your perception, ma'am, the cause of this headache po is because you use cell phone at all times. So, to lessen the pain that you experience from the headache, you actually rest, ma'am. And aside from headache po, do you feel nothing na po, ma'am? So, that's it, Ma'am Nika. So, we will just call you for the next interview and for the next question po. So, thank you, ma'am.